And we are live, ladies and gentlemen, and everybody in between. Good afternoon to you. Thank you so much for joining us and welcome to it. It is what we hold every single year when it is this time of the year. Actually, this time of the month. Speaking of that, it is Youth Month in South Africa, and we are celebrating all things youth. We have what we call a Youth Lekgotla. This is where we gather youth from different kinds of spheres, put them together and have conversations that are engaging with. And today it's no different. Thank you so much for joining us live on our Facebook page, also on our StreamYard platform, on YouTube as well. We there. Thank you so much for joining us. Also on Twitter, it is @n_health. My name is Vigan Kosi, and I will be with you for the next, say, 40 minutes or so as we get to dissect yet other issues that have been faced by young people. Today, we are shining the spotlight on youth in public health achievements and how to amplify those youth spaces when it comes to health, especially for them to be health conscious. And I'm joined by various young people. I don't know if you should call them young or should call them youth, but between the two, they'll tell me which one do they vibe with. Joining me for this conversation. I invite you to be part of it. Please leave your comment in the comment section below. If you're on Twitter, please tag us. It is at @in_health. You can tag myself. It is at Yamakosi. And making sure that we are sound and we look all crisp. It is Heavy Paling in the production side and making sure we come to me clear. I'm live from Ora Pop in Swane, which is in Loftus. Make sure that you pop in if you want to see this and experience it for yourself. I am joined on the line, coming all the way from Oram Pop in eThekwini, almost at Mkundu, eThekwini. It is Batabile. Batabile. Good afternoon to you. Thank you so much for your time. How are you doing?
Good afternoon to you and everyone that is watching us right now. Yeah. I'm very well, and thank you so much for this platform.
Thank you so much for actually honoring our invite. I really appreciate it. Let me just give you a big background of who Matabile is. They're a clinical associate with a postgraduate diploma in public health with 5 years of experience working with key population. Her decision to volunteer into public health was not only fueled by what she believed to be a calling to help people by aiding them into better health, but by the desire to be able to do so on a larger scale. As a clinical associate, she can only influence change one-on-one basis. However, as a public health provider, she's responsible. She responds to the health needs of the population. So that is Batabile Dlamini joining us all the way from Oram Pop in eThekwini, and joining us from, I'm guessing that you're in Parktown. But you let us know. It is Yonela Atibola, and I hope I'm saying your last name right there, Yonela. But if I'm not, please correct me by all means. Good afternoon to you. Thank you so much for your time.
Hi, how are you?
We're great. How are you?
I'm good. So I am based in Parktown, but right now I'm in the Free State. So we're traveling for the National Youth Day event tomorrow.
Wow, amazing. Did I say your last name correctly?
Tsibulani, yes.
Great. Let me just give you a bit of a background of Yonela. Is the project office, a project officer, marketing and communication at Youth Health Africa. They hold a BA in film and media from UCT, which they've obtained in 2018, and a BA honors in live performance from AFTA in Cape Town 2019. Yonela has over 5 years experience in digital marketing and public relations, as well as media and film and television studies. She is particularly passionate about youth development and the development of African storytelling. So that is Yonela. Yonela, thank you so much once again for joining me and coming all the way. I hope I'm going to, do justice to their bio. Joining me all the way from, I'm trying to guess, it's not the Seychelles, Mauritius, Dr.
Yes.
Good afternoon. How are you doing?
Yes. Hello, Ekanasi. So I'm good. I'm very good. I just finished work, in fact. Yeah, you got me at a nice time slot, so I'm happy to be here to give you a bit of my time to share what we have here in Mauritius, to share to not only Africa but the world. I'm sure you're all having you out there. Yes.
I appreciate you being here. And sorry, I was looking for your bio. I'm struggling to find your bio. As we continue, though, I will make sure that I mention some of the things that you are doing as one of our guests. But just to give just a bit of a synopsis, there are a Yali alumni from Mauritius. As
Yes.
I look for my bio, I will actually get to read it just to give more a bit of context in that regard. So, guys, we're talking about youth in public health and achieving achievements and how to amplify youth spaces to become health conscious. My opening question to everyone, and I think we'll start with Batabile and go all around as we did with introduction. Which what are then the roles of youth? What is then the role of youth in public health, and what are the achievements then after, and which are the challenges that the young people have actually overcame in public health?
Okay, thank you so much. I think I'd like to start by just explaining what public health is, okay? Public
Yeah.
health is a discipline that focuses on improving and protecting community health and well-being, okay? So simply put, it focuses on the health needs of populations, right?
Yeah.
So to respond to your question, V, the health and well-being of the youth have a major impact on the overall health society. Today's youth are tomorrow's workforce. They are parents as well as they are leaders, right? The role of youth in public health enables young people to influence processes and decisions that affect them. Currently, we are finding more and more youth taking up spaces that influence change. Myself and the two other guest speakers joining us today are testament of that. However, much work still needs to be done. We as the youth of South Africa need to do more to overcome all of the challenges we encounter. So challenges like alcoholism, risky behavior, suicide, mental health issues that are basically leading up to the bulk of these issues, inadequate access to healthcare and social ills and injustices, just to name a few, right? So currently there are programs and policies that are put in place to aid in this. However, as it stands, they are not doing enough. Okay.
Yeah, there isn't enough. Yeah. And I mean, I also want to say that how do we do enough? But while we still are pondering on that, but really, let's take it to Yonela. Yonela, how would you then respond to the opening question?
Thank you so much, V. I think Batabile captured it quite nicely that, at the end of the day, we have a huge variety of issues. And especially when it comes to youth, these are our issues. So we need to be in the healthcare facilities to address the issues. I think we can all really relate to various experiences within healthcare where, we have to speak to someone who's much older than us and maybe you're very uncomfortable. So, the role that we play is that we want to make it easier for ourselves to access the healthcare that is important for us, that is meant for us, that is important for us to be able to do the things that we do on a daily basis. So that is really the role that youth should be playing. And it's unfortunate that there hasn't been a lot of opportunities for us to play these roles. I think youth are, maybe it's something that we're doing to ourselves. We're associating ourselves with, maybe just, very light-hearted things, but people need to understand that we can be placed anywhere. We're ready to be in any specific situation, in any specific position, whether it be in healthcare. I've seen from the work that the youth that we work with have been doing, they really do make a difference, even if it's just a Q marshal, the vibrance and the energy that we bring, because they can relate to someone who looks very upset, telling you to go to this room and this clinic in this place, as opposed to someone who has a lot of compassion and energy. You're more keen to go to the clinic to get tested for HIV when you're going to be bumping into Batabile who have a fresh outlook, as opposed to someone else who's been there for over 10 years. So I think the role that youth play is very important, and I really would hope that more and more opportunities come for the youth to be able to be in those positions, whether it be from a junior level right up to senior levels as well. Yeah,
most definitely. And I think we need to then later explore, Yonela, what then we need to do to make sure that we amplify or we plug youth to those spaces if they are out there and if they are available, and how do young people do that? Dr. Sachin, in your view, how would you respond to the opening question?
Yes, but I think both of my colleagues just explained it so well that you have to see that it starts wherever you are right now. we are talking about public health. We're talking about mental health together, but it's not only mental health. Public health also resolves around safe water and everything. But I think it all depends on your surrounding. Let's say, like wherever you are, speaking about HIV, speaking about alcoholism and everything. If you have the support in your next of kin, in your peer group, this is where you can find the youth, the support. And if we are talking about the youth, I think the youth can be your own support system. You don't need to
Yeah.
look from far. You don't need to look in the healthcare system. It starts from wherever you are right now. It can be your siblings, it can be your parents also, it can be in your neighborhood, but it starts wherever you are. If you get the support right where you are right now, it always leads to better outcomes down the line. That's a challenge. I think you will all agree, if someone is supportive in your own neighborhood, in your own circle, it's better for you. You find that you were able to overcome that challenge, uh, 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 in opposite to when you were alone, or you had to seek to go to long distances, to go to somewhere else to find that help. So I think we have to make it a must that even the youth themselves become receptive. Not I am the one seeking help also, but I am the one being able to help someone else.
Yeah.
We should
And
be on
let's
the
maybe,
only one being the problem.
yeah,
Yeah.
later we should then dissect that and look at what avenues that youth can sort of explore, or how do you actually even amplify youth and make them health conscious, to say it starts with you, and how do you actually do that. But Yonela, to the point that you made, and I think it sort of like relates to the question that I was going to ask you, that what are the current methods, or that are available avenues that are there to actually develop things, because I think youth development is quite huge, especially if we're developing them in a sense of being in the public health arena. How do we do that? What are those methods? Are they there? Are they available?
I would say from what I've seen, I don't think they're as available as they should be. I don't think they're as, if they are available, I don't think they're as accessible as they should be. So, for example, when our youth join the Youth Health Africa program, we take them through monthly development sessions on various skills development topics. So things
Yeah.
like digital literacy, financial literacy. But then again,
Yeah.
that's only accessible to people who are already within the program. What of those who are outside of the program, people who don't have access to internet, for example? So, I mean, I would say that there needs to be more work done on how exactly we can access those. I know organizations like the NYDA really do try to do various workshops on various skills development, but again, it's about who is able to access these things, because a lot of these things are online, and are people able to gain access to go and engage on these topics. So I would say, from what I've seen, and I'm glad, I would hope to be wrong, that maybe they aren't as accessible as they should be. If they do exist, then maybe more work needs to be done for people to know more about the skills development, especially within public health.
Mm.
Yeah.
I got you. I've lost you there a bit. But okay, I think I got you back. And I think when you when you say that they are there, some of them are online, and it makes me want to ask the question on how can we then modify these these avenues, or these methods that are out there, to actually deal with or responding to such things as unemployment in South Africa, because we speak about the NYDA, speak about what Africa does, but besides those, and maybe perhaps with those that are still there existing and hard to find, how can we then modify them to respond to unemployment, because we are actually dealing with a lot of unemployment in South Africa.
Yeah. I would say from my side, because I deal with marketing, I'm very passionate about digital literacy and having, young people having access to those skills. And the
Yeah.
reality is, even from the primary school level, I don't think we're being taught enough about the importance of digital literacy, especially in 2023, where people still don't know the basics of computer literacy. And it's something that maybe we take for granted, that it's really important for everyone to be able to learn the basics of digital skills, and also how you can use digital platforms to earn an income. You know, we've heard lots of stories of people who are making money online, and that's something that, you know, you don't really need specific skills. You can develop those skills for yourself. But how are people even gaining access to the basics of learning those things? And I think that's really where the gaps are, and that's really what should be addressed.
Most definitely. But I believe Yolanda speaks about gaps, and I think key populations are largely part of the gap, or there is a gap between them and accessing healthcare. But I want to bring you in on, on this point of saying key population, then part of public health, and not only as clients or as patients, but as actually game changers.
No, no. Thank you, V. And again, I just want to define what key populations are, okay? So, key
Mhm.
populations are groups of people who are more vulnerable to HIV, STI, and TB infection, okay, due to higher risk behavior as well as other social barriers. So, currently, there are five groups of populations, and namely, we have sex workers and their clients, we have trans and gender diverse people, we have gay men and other men who have sex with men, we have people who use drugs, as well as we have people in prison, so prisoners. All right. So then to go back to your question, key populations are certainly game changers in public health, easily because they are aware of the health disparities affecting them. They actually live them. Okay. So who better than them to lead an intervention that aim to lessen the burden of HIV, STI, and TB infections amongst key populations? So us at Pop In Clinic, we provide, or rather, we pride ourselves by empowering staff, or employing staff that forms part of the key populations we serve, these being men who have sex with men as well as transgender women. They are at the forefront of advocating for our clients, okay? So a client coming in to consult at our clinic would have been assisted at least by two staff members that are either MSM or TGW, okay? We have seen that this not only puts our clients at ease, but further creates a conducive environment where their health needs are met, and in turn, they return to our clinics for continuity of care.
Yeah. I've got you. And sort of then it will respond, I guess, models like pop in, but maybe they respond to the rejection that some public spaces have when it comes to aiding people who are part of key populations. So why do you think there is that rejection with key populations in certain public spaces? Is it because they just basically are key populations, and perhaps maybe there isn't a broader aspect to say let's aid these people, because obviously health is a basic need, but let's aid them regardless of them belonging to a certain population.
100%. I think it starts, the foundation of it goes back to societal expectations. Okay. So the society we find ourselves in has deemed what is considered, I use the term normal very loosely. Okay.
Yeah.
So the society we find ourselves in has deemed what is considered normal as a law. Right. So anything that falls outside of this is easily misunderstood, and something that is misunderstood leads to stigma, biases, judgment, marginalization, public scrutiny, you name it. Okay. So health providers in these clinic settings and hospitals in the public sphere, okay, form part of the society. Okay. So these are the same people within their own community that are have certain biases against our key populations. Okay. So remember, when we're talking of key population, we're talking about sex workers, people who use drugs, prisoners, and the likes. And it is therefore not hard to imagine why there is such ill treatment that they face in our healthcare system.
It's quite interesting. And majority of the key populations, Matabile, are made up of young people. Let's just quite be honest with that. Gay men, bisexual men, people who inject and use drugs, people in prisons. Most of them are really made up of young people. So the lack thereof, in terms of the response from some aspects of public health, to not put them into the system and actually put them into care, really speaks volumes. But Dr. Sachin, I want to bring you in here and say, what can we learn globally to sort of respond better to the challenges that are faced by the youth, and especially from where you are in Mauritius?
The major obstacle to all this is, I think, the stigma. If we are able to include everybody, We let
Yeah.
go of all the stigmas because many times it might be someone close to you, it might be a brother, it might be a sister, it might be a cousin. But the thing is that if even that person who is not able to open up to you, so how will he go to find that particular service? So it's an atmosphere of stigma that creates this the hugest barrier to finding the proper healthcare. And we're talking about public health. That is, many of the services are available even free, having like condoms and etc. They're available free in some centers. But the thing is, the stigma of you going to that particular center and to get those protective measures, because of the stigma, they avoid it. They'd rather have that risky behavior than have protected sex or adopt particular behavior. Let's say we are talking about drug users. We are providing a service where you can we've produced an education system that will, like, they are aware that you shouldn't share needles, you should change needles. Like,
Yeah.
even if we accept that you have those particular habits, but at least don't share the needle with your friend, don't share the needle, have another needle. But the thing is, when you go to buy another needle, that stigma comes on you. So okay, people might know, okay, this one is using. So you see, we might be putting everything out there to decrease this incidence of this risky behaviors, I dare say, or we are trying to accept more people. But the thing is, if those people were born when the time they were not included, they might see
Mhm.
it down the line, but they were born in that period when they were still not included. So now, if we're trying to include them, they're still reluctant to go to that area, because we as professionals in this field, we might be very inclusive. Our approach is, we are more receptive because we are seeing those kind of people every day. I think most of us will agree that we face those people every day. So we have lost, even if we had that bias when we were born, we were but we grew into losing that bias and prejudice, and we are able to tackle all those challenges. But those people who need to receive that care, they might still be having that apprehension to come to us. So I think this is the biggest challenge. We have to desensitize them and to show them that we are here to help, we are here to assist. So whatever policies might be there, they are, the government or the policymakers are doing their best to put it out there. But the thing is, it's for the recipients. They have, I think, the biggest challenge is for them to come and accept what we are giving them. This is the biggest challenge.
Mhm.
Whatever services, in
I,
terms of psychologists, in terms of condoms, in terms of even the healthcare association, like even for HIV positive patients here in Mauritius, we give them free care and everything with the follow-ups and even social aid and everything. But they should come to the center to receive all of that. And this is where the real challenge is.
it looks like the model is the same throughout the world. I mean, when you talk about desensitization, I think it would actually even apply to how we do it here in South Africa. And when you talk about free health and all that, that's the model. But how then? I think it would be another question. But just by the way, as a sidebar, Yonel, I like what Youth Health Africa is doing, especially with employing key populations, because you don't see it every day where you walk into a facility, either be in public health or not, or you see somebody who's transgender, with somebody who's gay, where we see somebody who is part of the population, to make it more relatable to somebody that is accessing, the service, or accessing, whatever point of service, which is great. But how do we then amplify that? I get that Youth Health Africa is there, it's doing that. I get that, Dr. Sachin, that we need to learn then to desensitize. But how we then amplify it to say everyone who is part of the spectrum needs to feel included, and especially when it comes to basic needs such as health. They just need to get there. Is our messaging a little bit too harsh? Perhaps maybe Batabile is maybe Yonela, we're not reaching those communities that we're supposed to reach. With saying here's an internship. Dr. Asashiri, we're not saying you should not share a needle to the right people. Maybe they know the information, maybe they are not getting it correctly. Is it a problem of language? I think everyone at this point can just jump in to say what is the problem and how can we then amplify it and just make it a bit easier for young people to actually access these free services, or access public health.
I think Yonela had touched on it just briefly to
Yeah.
say that there are very little programs that are actually doing this. Okay, so when you're looking at the greater scheme of things, ideally, all of this should be put in our policy. So, like the national
Mm-hmm.
strategic plan. Probably if we can pull it up right now on in terms of employment, these things are probably on there, but it's the implementation that is just not followed through. So I strongly believe that it's our government that is failing us, because where I work, okay, at Orem Pop In, we are a government organization, okay, so a non-profit organization. So there's only so many NPOs that they can be in,
Yeah.
let's say South Africa, for example,
Yeah.
and how many people then are accessing this kind of services? It's not a lot when you compare to the population that we have. But if the same frameworks that we have and would be implemented in government and in existing social structures, in where in society,
Yeah.
then a lot more people would be able to access healthcare, as well as not only healthcare, but feel comfortable enough to access it and get the necessary help that they need, that they usually get from organizations like
Mhm.
ours.
Mhm.
Yeah.
Perhaps maybe thanks, Batabile, for that. Yonel, I want you to respond to this one. Is youth then participation enough? Because Batabile speaks of that these things are there, but then in terms of implementation is different. But let's talk about then participation. Uti, is youth participating with these kind of interventions? And perhaps maybe we can use YA as an example for this part of the conversation to say, obviously they are closing in the gap. Is it enough? Are youth participating?
Yeah, I would say so. For example, again, if we take Youth Health Africa as an example, if we're looking at our recruitment processes, right? We
Yeah.
get a lot of engagement with young people. There's a lot of passionate people out there. They've seen what is going on within their own communities, and they do want
Mhm.
to get involved. A lot of people have
Yeah.
even volunteered their time free of charge. But there just isn't a lot of opportunities available. We are sitting with a lot of people who have reached out wanting to be part of such initiatives. They want to help their communities, but the reality is that the opportunities just aren't there. And to build on what Batabile has said, to a certain extent, our government hasn't really opened up those opportunities as much as we would like them to. And maybe it's also a situation, as you mentioned, if we're talking about healthcare campaigns. I would say from my side, the messaging that we use, perhaps we're not as aggressive as we should be. Perhaps we're not wanting to. I think we're still too conservative, especially as young people. Maybe we're still thinking too much about what other people think of us. And I mean, I'm thinking about organizations like Pop In doing such amazing work. And really, what you guys are trying to address is something that is so stigmatized. Within your communities, and at the rate that people are being killed, all of these things are happening. We should be having all kinds of messaging and conversation, but there's perhaps still that thing where you're wanting people not to feel uncomfortable. But I think at the rate that we're at, we should maybe stop thinking too much about people feeling uncomfortable, because the situation is quite dire. Things are
Yeah.
happening. There's unemployment, healthcare access is limited. So the opportunities are there. The opportunities are missing, but there are people who want to access these opportunities. So maybe
Yeah.
that's really one of the gaps that needs to be identified.
I've got you. There's section. Let's talk about achievements. I mean, it's not all doom and gloom. I mean, you look at what YA is doing in terms of in terms of responding to youth unemployment and really placing our peers where they should be and giving them experience. Which again, kudos to you guys. Look at what Popin is doing. Giving peers an opportunity to also to come into the program, but not only as clients, but also as decision makers. You look at what you were saying. You guys are doing there at Mauritius to give people free health. So, what are some of these achievements that we should celebrate? Because, like I said, it's not all to include.
Well, before talking about the achievement, if we talk about how to tackle the situation well, wherever you are, I think when you say there's something done by you for you, this is where you get the sense that you can go to that group. Like, I think the challenge here is if we could get those people who have like one person who has succeeded to go through that program and is a success story, he should be included now in that group to take on, from his friends or his colleague. Like he will have, because people will identify to him, okay, this guy went to that particular group and he's been able to go through that treatment, through that process, and now look where he is. So I identify myself as that person. And then if he got through, I can go through. I think we need to find those particular role models. Maybe we don't need many. If at least in a particular NGO, in a particular group, in a particular association, we have at least one success story, we should maximize on that success story. Then we come to, well, what have we have been doing in Mauritius? We have the Pills, which is an NGO that tackles HIV in Mauritius, and the very founders of this association are people who had been inflicted with that HIV issue, and they know the challenge that they went through, and this is how they are able to know exactly what those people actually need, because they've been, I won't say victim will be a big word, but they've been the one who have suffered from that taboo, from that stigma, from those diseases, and they now know how to properly give
Yeah.
what actually is in, because even I am a doctor, I'm a professional, but I'm not on the other side. I've always been on my side. I don't know what is on the other side. So even
Yeah.
I know it, like what the books have taught me from experiencing, but still on my side of the table. I've never experienced it on the other side. So maybe I will lack some of the personal touch, the personal experience and everything. So even though I've learned everything by the books, I've not lived it. So this is where maybe the most open I can be. Even I say I understand, but I would
Yeah.
never know how it actually feels to be there. But finding someone who has gone through that and then actually being able to succeed through it,
Yeah.
who have went through it, I think this is where you actually make the greatest impact. You're not giving the people a false promise. You're actually showing them that here we have a success story. It's successful. This guy has actually gone through it and is now okay, is able to live normally with no stigmas and everything, is accepted by everyone. So why not you? Why
Yeah.
not you?
Yeah, I think my colleagues are nodding there when you speak about success stories because they know a lot about success stories and they can attest to the good thing. We have a lot of success stories within
Exactly.
the
That's where you
program.
should be going.
Yes.
Yeah. I don't want to hold you guys and have you guys to myself. I want to share you guys with everybody that is watching. And I see that we're getting a lot of love. Thank you so much. But there is no question as yet. It is just a lot of reactions in terms of the conversation, and everybody is really getting, a bit of what they needed for this particular conversation. So, Koa, to your comments, let's talk about some of the things that young people have actually achieved over the years, and are we then being compared to the previous generation? I want to then touch on a bit of leadership, and I'll take this question all round. Actually, let me, before I take this question all round, let me just finish with individual questions that I've had for you. But maybe let's go back to you and talk about some of the services that public health still needs to provide to young people. And especially as part of keep population, because yeah, someone can say young people are not accessing healthcare because they're being rejected because maybe they don't feel like they belong or they're being treated differently. But what are some of those things that are lacking within public health that can be amplified to better respond to young people's needs?
V, I lost you there. Was that question posed at me?
Yes, it was.
Okay. Okay. Not a problem. So the first thing, okay, I think we just slightly touched on this, is that we need key
Mhm.
population friendly settings, okay? One that is
Yeah.
free of judgment. This is the main one, okay?
Yeah.
The second one would be mobile health services that go into the community, okay, to offer health
Mhm.
services to our key populations. This means going to hotspot areas, for
Mhm.
example, under a bridge to find people who use drugs, going to establishments that have, sex workers, or, the spots or
Mhm.
the corners that you may find sex workers, and going inside the prisons themselves to find the prisoners, okay? And then we also
Yeah.
need to a rather strengthen upscaling of HIV, STI, and TB preventative measures such as PrEP, condom loop distribution, health education, community dialogues. So, dialogue similar to the ones that we're having now, as well as desensitization training, just to name a few. Okay. And my next point, the doctor touched on it. Okay. So we need to start applying harm reduction models. Okay. So this is centered around providing, or rather reducing harm as much as possible. Okay.
Yeah.
Okay, so for example, I give an example of a harm reduction strategy was the one that the doctor gave for providing free needles to people who inject drugs. Okay, so this is controversial. One person may look at it and say, no, but you're enabling these people. You're saying that here you go, go ahead, use your substances, inject yourself. But at the end of the day, people have the right to autonomy. So I can do whatever it is I want to do with my life. And, substance use, if you go way deeper in it, there's so many things that surrounds it and affects it. And the person, for them to get out of using substances, that's up to them. So no matter how much the family takes them to rehab or they pray or whatever it is they do, they'll still continue using their substances. So whether they get access to clean needles or they don't, they will use their clean needle. They will continue injecting themselves. So what the strategy is saying is that here's access to clean needles, use them, because by so doing you'll be decreasing the amount of needle sharing. Okay, and by so doing you'll be decreasing the amount of HIV infections as well as bloodborne diseases. So applying similar strategies that are reducing literally harms as much as possible, which condom and lube distribution is one of them.
I got you. So young people actually have access to these, and actually even the information that we are sharing on this platform. Yonel, I want to touch on what the impact. I think we've touched on what you guys do, and but it has impact. Let's reflect on that, on the impact that South Africa has had to young people in South Africa, especially placing them. I don't want to lie to you. Every time when you speak about Youth Health Africa, people's faces lit up because they know opportunity, they know placements, they know that they're like and I'm actually thinking, I want an intern, give me an intern, but hey, you're not there. Go ahead.
Noted. Thank you so much. I think what Bathabile mentioned, and also what Dr. Session mentioned as well on impact stories, when we're talking about success stories, and really just things around creating safe spaces, that are free from stigma. So thinking about, for example, whenever I engage with some of our youth, especially during work readiness training, I always give them an example of if you're thinking about a young girl's age 14 coming into a healthcare facility, testing for HIV or testing for pregnancy, that she's already sexually active. And if you're going to tell her once she's tested negative that now you need to abstain, I think you're not being realistic. You need to provide a safe space. People might say, why are you telling a child to continue being sexually active? The reality is she's already sexually active, and you should applaud her for being, having the courage to come into the facility. You being there has saved her life because she's able to talk to you as opposed to being able to talk to someone who doesn't understand. So, providing that safe space free from stigma is really why what our interns at Youth South Africa are there for. So that's what we've placed them there for. And that's why I'm glad to hear that people's faces light up in that way, because really we're trying to place people in healthcare facilities to allow other people just like ourselves to access these services without being judged. That's why collaborations with organizations like Popin are so important, because when we're talking about young people, we're talking about all types of young people, people from different communities, people who are experiencing various challenges. And that's really when I'm so proud to talk about the impact of Youth South Africa, the things that we've been able to do within the different communities, the stories that we've been able to hear from different people. It's really just something that warms my heart as well. So whenever people come and ask for interns, it's exciting because it shows that, there is impact that's being created within facilities and the need builds up from there.
I want my intern, Yonela. Very safe. Give me an intern. Dr. Sachin, you've been part of YALI, and I want to touch because I think, what Yonela speaks of the great impact that Youth Health Africa has. I want to sort of say it's quite similar to what YALI has, but I think YALI is on a more broader space because it is, you all young people across the world. In your view, Yali, and its footprint, what kind of an impression did it leave make on you, and what kind of impact has it left with has it left rather with young people across the world?
I think Yali has brought the best of thing, that is to accept diversity. You have to say that because we all come from different countries, we all have different backgrounds, we all have different cultures, but we were able to stay together for 3 weeks without ever feeling uncomfortable. So you grow to act, you become more receptive, more open-minded, because people live differently in different places, even in one same country, but different corners of that same country, you'll have different cultures, different ways of living. So Yali, we are forgetting about the what we were taught there. We were only talking about the people, the way, because even those who were guiding us, our facilitators, were also youngsters. They were alumni of the Yali program. So they've, like what I said, they've been where we were, and they were able to direct us in the right track because they were where we are actually right now. So they know how to guide us to prevent us from straying. But we were in it was an absolutely marvelous experience. We met people from different, I will say, different ages, different beliefs, different cultures, different, like, so many things were different. And sometimes we were sometimes shocked because we were expecting something in our head, but by talking to them, we were like amazed to see that they're totally different person. But still, we are not like we are not afraid to still communicate, to attach, to make a bond, because it was everything about friendship, about community, about one Africa, about, and in the end, about unity. So you say it's an amazing experience. I will recommend everybody to go for it. You have to
We
go
are
for it. It's an
definitely
amazing
joining
experience.
Yali. I want to join Yali as well. I want
You
to do
have to.
that,
You
but
have to. Yeah.
yeah. I'm just gonna throw you guys one last question and then we wrap it up. It's just some follow-up questions that we've had as part of the conversation, and I think leadership also comes through this conversation. And I want to say, then, how do we then become responsible leaders? Especially in our own little corners. How do we then become, what you guys have reflected on? Being change agents, being testimonies, being stories that have actually worked, and we are that example to other people, to other young people, and say, yeah, it's possible that you can do that. How do we do that? Maybe let's start with Obatabile on saying, how do we in our own spaces, especially as key pops, Obatabile, how do we become leaders, and actually better, I want to say better leaders, but how do you become leaders in general?
I don't want to lie, V. You were breaking through most of that. Please just ask the question again. I would hear,
So
but
sorry.
there was, yeah.
My question is, then, I'm saying, out of the conversation that we've had, we've spoken a lot about young people, but now I want to speak about leadership, because I think it comes through in the conversation. And I was saying, how do we then become leaders? And maybe I can actually even throw it and say, how do we become responsible leaders? Because we are the current generation. These young ones are coming up, they're looking up to us, but how do we become then the change agents? How do you become the what you guys were saying, Uti, some what is it, positive stories that people can look out for?
Okay, I think I got the gist of that. Okay, although you're still breaking, I think by we just need to empower ourselves through knowledge. Number one,
Mm-hmm.
okay, because we can't educate, we can't inform or try to inform any change that we want to see without knowing exactly what we need to know in order to do that. So it would be empowering
Yeah.
ourselves with knowledge, and it's through engagements like this and platforms like this, creating a dialogue and imparting valuable information. And also, we find ourselves in the times where there's a lot of technological advancements. So anything that you need to know, you don't have to go to school for now. If you find yourself asking a question and the next person can't answer it, go to Google, read
Yes.
studies, go to sites that you trust with that are fact checked, and then just that's how you start. You can start as little as that, because I don't want to say then, yeah, go to university, do this, apply for this job, do that,
Yeah.
because some of these things aren't practical. Okay, so we need to empower ourselves, and this anybody can do.
Mm.
I got you. Yonela, is it too much responsibility, do you think, that so much is put on our shoulders?
I mean, yes, I would say, of course, it is too much responsibility, but I guess it comes with a willingness to, make an impact. And again, as Batabile said, wanting to seek knowledge. I think, being a leader is one thing, being a responsible leader is something else. You're never too good to learn new things. And if you tell yourself that you know enough and you're done, then you won't be able to grow and move forward. So, you should always be willing to seek knowledge. And for me, I've found that, for example, when I connect with our youth within our program, that's really when I learn a lot. I'm sitting in an office, very privileged, certain information, but when I go out and I engage with people, I seek further knowledge. And that's really what has helped me to build in terms of becoming a more responsible leader in that way. So never be too good to learn and seek knowledge, for sure.
Yeah, most definitely. Dr. Sachin, in closing, what would be your remarks with the conversation that we've had today?
Yes. Well, if we're talking about leadership, what we've learned is you can be born a leader, but you can also learn to lead. So
Yes.
that said, everybody can become a leader. Again, you can be an extrovert, you can be an introvert, but you can still be a leader. So there's no particular personality also that indicates that, okay, if I'm introvert, I can't talk to people, doesn't mean I cannot lead. Leading is for everybody. You just need to start by a small step. Leading is
Yeah.
also to know when to step aside and to let someone else take the lead. Okay, because if I'm the leader and I want to do everything by myself, even if I'm not capable, I'm not doing a good job as being a leader. You should know when to act and when not to act. I will end by this. I think this is enough
Yeah.
to talking about leadership.
Right. Drops mic, walks away. But thank you so much, Dr. Sachin. Ladies and gents, thank you so much. I really appreciate your time. I think we've dropped pearls here in terms of, the available opportunities, or actually even, just stimulating conversation for young people who have been part of this. And I know that is going to be more engagements further just beyond this point, because I think conversations like this are quite important, especially on a month like this where we are just all about young people and celebrating young people. But I appreciate your time, Batabile. I appreciate your time. Thank you so much for, holding the fort when it comes to all things KP, all out there in Etegwini. Yonela, I'm waiting for my intern. But thank you so much for what you guys are doing in Africa. It's quite important. Dr. Sachin, I appreciate your time all the way from Mauritius.
Yes,
We are
thank you,
definitely applying
thank
for
you.
Yadi. Yes, we are
Yes,
definitely
please
applying
do,
for Yadi.
please do.
So that it can be more of us and we can actually be empowered. But thank you so much for your time, guys, and I hope to see you
Thank
again.
you.
Thank you
Thank you
so
for the
much.
opportunity.
Alrighty,
Bye.
and for you at home for tuning in, thank you so much. You can check out this conversation if you've missed it. I've been speaking to amazing young people who are doing amazing things in their own field, and we've been reflecting on young people, the achievements that we have actually had, and how do we then amplify public health to be more youth friendly. And I hope that you've actually enjoyed this conversation, because I literally brought in the best of the best. And I'm going to do so yet again. Join me on the next one as we look at Pride Month right here on Around Pop In. My name is Vigan Kosi, and that's all. That is what we have for you today. Until then, happy streaming. Bye.